we need to make sure we keep the lights on going forward. You know, in Health and Human Services particularly, we're looking at about a $10 billion budget, and anywhere from 60 to 70% of that is federally sourced funds. And we have the Federal Government Accountability Office telling us every year that their funding is unsustainable. We've got the Congressional Budget Office also telling us this is unsustainable. We have any number of other private think tanks telling us the same thing. And you know, when we're talking about that, it's kind of like the red light on the dashboard. It's there so long you almost forget about it. That we've been hearing these warnings. You know, Erskine Bowles, right, came back and said debts and deficits are like a cancer and they're going to destroy the nation from within. So we've been hearing these things for a while, but what really concerns us in Utah is these are the most vulnerable in our society. You know, this is the sick, the poor, the elderly, the disadvantaged, and they're kind of being put on the roulette wheel and said, let's just take a chance if we can continue to provide these services. Well, that's not how we do things in Utah. We want to look very prudently, very circumspectly, and not just take the federal promise at face value that they're going to continue to fund these services, because all of their auditors are telling us that it's unsustainable. So we look at the most vulnerable in our society, and then we're going to stress test and see what the reasonable duration of those promises look like, how we can mitigate any diminishment in funding, and then how we contingency plan. We hope we never have to break the glass in case of emergency, but in Utah we've been well served over the last decade and over the last number of centuries, that we plan very prudently and look forward to the future, and you know, we look to the worst and provide for it. And so those are some of the things you're going to see in the interim. We're going to start out by looking at the nature of the risk and magnitude of risk, and then looking at how just general good principles of access and increasing quality and lowering cost and increasing access, how those can help us both mitigate and contingency plan.